I did a Google search on healthcare crisis, and the first mention I obtained was in 1969, I believe. So we've been in crisis for 40 years. Now, obviously, anything that's been going on for 40 years is hard to describe as a crisis. But another way that I've looked at this is if you do look at all the ways in which we can measure costs in the system, cost to individuals, to business, to government, to federal government, to state government, coverage, who is uninsured and who isn't, who has insurance, what's the quality of that insurance, do people have sufficient insurance to really cover against costly medical events, and the quality of what's being provided in terms of the care that's being provided, the outcomes in terms of people's health status. If you look at all those things, they have grown, we have more and more measures of them. There are a lot of those things that we didn't really have a way of measuring until the 1970s, so we didn't know whether we were getting better or worse. It really wasn't until the late 1980s and early 1990s that we had pretty clear evidence that across the board the system was in trouble. But then we had a little bit of some gains in coverage and some gains in cost control. It is in this period right now, under this, during this course of debate about healthcare reform, where we have unquestionable evidence across the board that the system is in trouble in a number of well, essentially every respect that one can imagine. And so in some ways, if we're going to talk about crisis, we have clear evidence of crisis today in a way that we really didn't have in the past. But that said, there are ways in which systems go on under stress for long periods of time. If by crisis we mean a moment of collapse coming in the near term, we're probably not at that point yet, but we are certainly moving in that direction.